Hello everyone. Today in this video we are going to discuss ultrasound guided transversus abdominis plane block under following headings: its anatomy, sonoanatomy, indications and the technique. To understand the abdominal anatomy, let's discuss its muscles, nerve supply and the dermadomes. Now if we see the abdominal wall, posteriorly it consists of psoas major, erector spinae, quadratus lumborum and the latissimus dorsi. Anteriorly there is rectus abdominis. And if we see the lateral wall of the abdomen, the innermost consists of transversus abdominis and the thick stacked muscle is of internal oblique and the outermost is the external oblique. And now the innervation. The innervation of the anterolateral abdominal wall arises from the ventral rami of the spinal nerve T7 to L1. Spinal nerve arises from the vertebral foramen. And the ventral rami runs between the external oblique and the internal oblique and pierces the rectus abdominis and form anterior cutaneous branches. In the midway, it also pierces the external oblique and form lateral cutaneous branches. And these now supply the skin, subcutaneous tissue, muscles and the peritoneum of the anterolateral abdominal wall. T12 also communicates with iliohypogastric nerve, supply gluteal region and hypogastric region. Iliohypogastric nerve also communicates with ilioinguinal nerve and supply the upper and middle part of thigh and the part of genital region. And now some relevant sonoanatomy. Place the probe over the mid-axillary near the iliac crest, in between iliac crest and costal margin. On ultrasound, you can appreciate the pelvis, its iliac crest, and as you slide upward, you will see the three muscles. Then change the probe position from longitudinal to transverse plane, scanning in a plane perpendicular to the structures. And in this plane, you can very well appreciate the tectonic sign of external and internal oblique muscle. And this is external oblique as it is exterior and it runs diagonally downwards. Internal oblique perpendicularly oblique to external. Transverse abdominis. And this is the tap plane where we have to give the drug. Now, indications. Tap block is most often used to provide surgical anesthesia for minor surgeries, superficial procedures on the lower abdominal wall, and post-operative analgesia for below umbilical surgeries. Unilateral or bilateral, depending upon the surgery. Unilateral like appendectomy, inguinal hernia, and bilateral for umbilical hernia, exploratory laparotomies, bariatric surgeries, gynecological procedures, and neurological surgeries, etc. The preferred technique of needle alignment for tap block is in plane needle alignment. As with this, we can see the entire needle piercing the muscles. The needle is piercing the fascia between external and internal oblique muscle. Now one needle is in the internal oblique muscle and reached the tap plane. So now I am giving the drug 20 to 30 ml of 0.2 to 0.3% ropivacaine. This block is volume dependent rather than the concentration. It relies on the local anesthetic spread. So that's it. I hope this video will help. Please like the video, share and subscribe my channel.